that this disease begins with damaging the brain, inside the brain. But what if it doesn't? What if these lesions are forming or starting to form from the very smallest blood vessels that are in the brain? So not in the brain itself, but starting in blood vessels in the brain. And that's exactly what the research has been showing for decades, for over 100 years. So what if the damage that we're seeing in those small blood vessels in the brain is originating from a parasite that infects our red blood cells? So today what we're going to talk about is, number one, what type of organisms, microorganisms, parasites these are. There's a lot of research on that. Also, we're going to be talking about how they infect the blood and how they infect the brain, and then also how they're causing this vascular disorder that the most current MS research is showing. If we haven't met, my name is Pam Bartha. I'm the author of Become a Wellness Champion and the founder of Live Disease Free. I was diagnosed with multiple sclerosis over 35 years ago. And it's so interesting that what I'm sharing with you today, I've actually, in my blood work, there have been changes in my red blood cells that my doctor just says, oh, you're just different. And I'm like, well, if you don't know what it is, just tell me you don't know. But if anything is abnormal, there's got to be a reason. And so what I'm going to share with you is over a century of research, all from different angles and more current research also pointing to what is causing this. What their researchers are now feeling is that MS is more of a vascular disorder than an autoimmune disorder. And so we're going to talk about all of this right now. So let's first start with the parasite itself. So the parasite we're talking about is a type of malaria, Babesia type parasite, and it infects our red blood cells. So we call it malaria Babesia because we're not testing. We don't know what it is, if it's a cousin of one of these. But what happens is this protozoa, it's different than a bacteria. It has a more complex cell structure, and it infects and lives in red blood cells. It causes them to become sick. They become stiffer than they normally are. And that's very important because they're supposed to fit through these very tiny little blood vessels in different parts of the body, but especially in the brain. And so they become more rigid, but they also stick together. They become clumpy. So they stick to the blood vessel walls. They stick to each other. They can actually obstruct small blood vessels in the central nervous system and cause brain bleeds, which we'll talk about in a minute. So they're really triggering a lot of inflammation in blood vessels. Some of us might have higher cholesterol because of that. Our body will produce more cholesterol to offset the vasculitis, the inflammation in our blood vessels. They are going to interfere with blood flow, especially in those very, very small blood vessels in the brain and the central nervous system, but other parts of the body also. We call them capillaries. So that, number one, the red blood cells can't fold and squish in those little blood vessels, and they also become clumpy and stick together and can block those small blood vessels. So this is really significant because this can happen in the brain and in the spinal cord. And in fact, some MRI studies have found higher incidence of these tiny cerebral microbleeds. So we're having little blood vessels in the brain that are bleeding. They're called microbleeds in people that have MS, and it's much higher in people that have MS versus healthy people that do not have multiple sclerosis, especially in patients that are older. So it's really linking these microbleeds to greater disability also. So the blood damage is correlating to brain lesions. So we already know from advanced MRI that brain lesions tend to form around small blood vessels. I've talked about this before. This is actually in the 2024 updated McDonald criteria, how they diagnose and how they treat multiple sclerosis. So in the vast majority of lesions in multiple sclerosis patients, they find this little blood vein running through the center of the lesion. And they actually have a name for it. They call it the central vein sign. And this is really an indication of where we're starting to see a breakdown of the blood-brain barrier. So normally we have these little blood vessels that enter our brain, and that's where there's going to be exchange of nutrients and waste and other things. But they have a layer of cells that are tightly packed, and they act as a blood-brain barrier. They prevent things from going into the brain that shouldn't go into the brain. But when we have compromised blood vessels, where we have obstructions and microbleeds, then those little blood vessels in the central nervous system can burst. And of course, all of the contents in the blood vessel will spill into our brain. And of course, that's going to cause a lot of the immune reaction. And this is the inflammation. So it all makes sense. Have you guys ever heard about any of this? No, but it's research, it's peer-reviewed research that's been available for over 100 years. So it's not like the scientists have to go looking for something new. They have to just disprove something that these amazing researchers and doctors knew in the late 1800s, early 1900s. So to disprove them, to show, no, it's not parasites, but they don't want to. They're not bothering with that, which is really sad. So when these small blood vessels, they're repeatedly damaged in the brain and in the spinal cord, we have these microbleeds, we have leakage of the blood vessel walls, we get iron deposited. So the red blood cells, they carry a lot of hemoglobin, which is iron. So they're actually seeing this ring of iron around the lesions in MS. And that can easily be from the red blood cells that are becoming deposited in the lesion. The immune system, the body's going to clean up the mess, and it could leave a ring of iron around that. So over time, this results in tissue damage, in white matter changes. Also, we see these lesions on the MRI. So this is a whole different way of thinking about MS. Instead of like, oh, our immune system is attacking our nerve tissue for no reason, it's like, okay, let's look at these lesions. Oh, there's always this vein in the center. Oh, there's all these changes. I've done talks about all of the changes in the vascular system of MS patients. And so it's all coming together, it's all clicking together. And I'm not saying that this is the only parasite that causes MS symptoms and MS damage and lesions, but it looks like this is a really big one. I've shared lots of research on other parasites. We talk about how our microbiome becomes like a weedy garden inside of us. We have multiple different types of pests, parasites that are causing symptoms, and some of it can be stemming from our gut too because of the gut-brain axis. But this is a really big one. I think this is very significant. I believe that for myself, having a history of all the changes in my red blood cells and then having an MS diagnosis, I really believe that this is part of it. So, why is the immune system attacking the brain? Is it attacking the brain, or is it attacking content from the blood vessels that should not be in the brain? And that is really the key question to ask. So what is damaging the blood vessels? So instead of, why is the immune system attacking our nerves? That's not even accurate. It's not helpful. It's like, why are we having these lesions forming around blood vessels? Why are we seeing the iron deposits? What is the immune system fighting in these areas? And that's a really important thing to talk about. So evidence that has been overlooked has been dropped. There have been many, many studies over decades, actually, as I mentioned, stemming from the 1800s, the late 1800s, early 1900s. One researcher, Kistler in particular, they were finding 30 to 40% of MS patients were reported to have antibodies against a malaria-like organism. I think they felt it was malaria. Back in the day, they did have malaria outbreaks, even in the United States. And those reports, it's important to mention that back then in the late 1800s, they did not have very good testing methods. So number one, is difficult to find this parasite. It kind of hides in red blood cells. So the fact that they could find 30 to 40% of MS patients had antibodies against this malaria microorganism is quite astonishing at that time. So these parasites can hide in very low levels inside red blood cells. So the standard blood smears and routine tests can easily miss them, especially if we're dealing with a chronic infection. So what's really important here is that many of these patients they never traveled to malaria endemic areas. So the people that were tested, and they found 30 to 40% of those MS patients had antibodies against this malaria protozoa. They had never been to a tropical country where they had malaria. Interesting. So this really points towards the possibility of a chronic, undetected infection in at least a subset of MS. And it'll be interesting to see what percentage of people with MS actually, that this is one of the main culprits. So research patterns that don't fit autoimmunity. So when they looked at larger patterns, so larger populations, they found clues that didn't fit a simple, isolated autoimmune story. So some more historical studies, they looked at regions where MS rates overlapped with areas that had significant malaria exposure or malaria-like infection in the past. So especially when they looked at older maps and before our healthcare, they say erased malaria, but I don't know if we still have malaria even in Canada. They just don't really track it. So they also found seasonal patterns, so MS flares often peaking in the spring, which was similar to seasonal patterns that were seen with certain infections, including this malaria-like protozoa. So the flares in the spring of MS. So a biological pattern like this where they're finding, that there's more MS where they had malaria in the past, and they're also seeing that there's more MS in certain times of the year, which corresponds to like certain infections like malaria. So these patterns are tied to infection rather than autoimmunity. So this is an interesting newer study in 2021. I've done a whole talk about this a couple of years ago. I think it was 2021 when I actually did it. So this was great work done by the University of Calgary, Alberta, Canada. And they studied primary progressive multiple sclerosis patients. They gave them hydroxychloroquine, which is an anti-malaria drug. And keep in mind that for primary progressive, they really don't have a lot of options, not to say any of them are really good options anyhow, but definitely they don't have good options for primary progressive multiple sclerosis as far as treatments. And they noticed that over time in this study, over 18 months only, that it significantly decreased their progression with, more or loss of mobility. So it significantly decreased the worsening of their mobility in that short of a time, in a year and a half, which is astounding because primary progressive multiple sclerosis doesn't really respond to many treatments. So that's really fascinating. So this is not a classic MS immunosuppressive drug. This is a malaria drug, the hydroxychloroquine. And so it, like with all these drugs, they're like, oh, it's supposed to, like the MS drugs, that they're supposed to help with myelin repair. But this is a malaria drug that is not, there's no use for it with MS and no use for remyelination. And yet it really slowed down the progression in multiple sclerosis primary progressive. So that's really interesting. So this is really helping, or is it really helping because of its effect on a specific infection, which supports the immune system? So if we're even not treating the infection effectively, but if we are actually decreasing the numbers of the infection, the presence of the infection, we're taking some pressure off the immune system. So it's helping both, which is amazing. So long before the MS drugs, physicians were using quinine. So this was basically after we had the outbreaks of malaria in the United States, and they were giving everybody quinine, and they were like, oh my gosh, people that had MS, when we gave them quinine, they had remarkable improvements and sometimes recoveries. And I think that's really what started this whole interest in looking at malaria drugs for MS. And this was, again, like the late 1800s. It's crazy. So across different reports in the late 1800s to the early 1900s, MS patients had improvements in spastic weakness, tremors, difficulty walking. So these are all improvements they had when they were on quinine. And they showed remarkable improvement when they were treated with quinine. And quinine does one primary thing. Again, it's treating protozoa that live inside red blood cells. So it is not considered an immunosuppressive drug. It's interesting, it's used for lupus, possibly for arthritis also, maybe fibromyalgia, those kind of autoimmune diseases they call. So then you wonder, I wonder if that parasite is involved with those conditions also. So it really gave significant neurological improvements. What I'm going to do is I'm creating a blog post with all of this research on it. I do have a link that I can give you. If you just type the word malaria, our team will send you the link of all the research, the study. So what I do is I take the study, I put it on a specific format, like AMA format, and I get a little summary, like 2 or 3 sentences of the most critical findings of the study so that it's easier for you to understand. And I give you a link so that you can actually click on the link and you can actually look at it. Some of you might be science buffs, some of you may not be that interested. You can share it with practitioners, but it's really important that we get this research to, and maybe the University of Calgary, maybe that's why they did this study on, giving hydroxychloroquine to primary progressive. Maybe they looked at the research and they're trying to see if they could get any positive results, and they did. But it's really sad that it is just not happening. So type in the word quinine in the comments, or you can direct message me, quinine, on Live Disease Free on Instagram, on Facebook, Rumble, and our team will send you the link probably tomorrow morning. Make sure that you're connected with me also. So you can go to livediseasefree.com. You can just put your name and email. You'll get our newsletters every week. We've got some exciting things coming very, very soon that is really going to help a lot of people, because a lot of people are frustrated. They're not getting answers from their practitioners, not getting helpful, meaningful answers. A lot of people are starting to search on AI, they're going onto large language models of AI, and they're getting really conflicting information too, because it's really programmed to follow standard of care. So you're kind of getting the same, but it's inaccurate. At least when you're getting from a human, you know that it's an accurate version of what they believe. But when you're getting it from AI, you don't, unless you know what you need, it's very dangerous to get health information from AI. So we're working on something that is going to be a really amazing tool that's going to help a lot of people in a very cost-effective way as an educational source, so that people can, ask questions and bounce ideas and figure out what's best for them. With all of this 10 years of research heavy research, it's been actually 35 years of research, but I've been doing like live events a lot more and the more scientific research. So we've got a lot of amazing insights that you will not find anywhere else. So make sure you're connected with us. So going on to the next point here. So clinical observations. Physicians are documenting that when people have malaria, especially when the malaria moves into the brain, into the central nervous system, they develop neurological symptoms very similar to multiple sclerosis. So we talked about Lyme, also Borrelia, how that is very similar. So again, it's not just one parasite. It could be, for some people, it's more this. For some people, it's more the Lyme infections, or it's more of the malaria type infections. Because these parasites, they will cause damage to the same nerves if they're located in that area. So with this malaria protozoa, it's a malaria type protozoa. It could be Babesia, it could be a cousin, but the symptoms that when people have these infections and it gets into their brain, they can have spastic paralysis, abnormal gait, tremors, eye movement problems, speech difficulties. So these are just in a nutshell. There's a lot more symptoms, but it shows you that they're very similar neurological symptoms to what we would see with multiple sclerosis. And in some cases, symptoms would improve and then return. So they also, this malaria-like protozoa in the brain, they know that it causes like a relapsing, remitting course, just like what we would see in multiple sclerosis. So this relapsing, remitting neurological syndrome, very similar to what we see in clinical multiple sclerosis. So this has been documented for decades before MS had ever officially been called an autoimmune disease. And it maybe isn't officially called autoimmune with every practitioner, but there is a lot of consensus with standard of care that they would like to call it autoimmune, but there's a big debate going on with that, even amongst themselves. So there is this pattern. So this infection, this protozoa lives inside the blood, lives inside red blood cells, and it causes symptoms that are identical to multiple sclerosis. And a drug that targets this infection actually helps to bring improvements, symptom improvements, both historically and also more recently in MS patients. So this is not random. This is a pattern that we're seeing. And it strongly suggests, again, that infection is causing multiple sclerosis, and the blood vessel damage that we're seeing, this vascular disorder in multiple sclerosis, could be due to this parasite, this blood parasite. And again, since the 1800s, the late 1800s, they've known this. This is when the clues started coming out. So why is this missed? You guys let me know why you think this is being missed. It's so frustrating. I do understand that it's a little bit more challenging when you're dealing with different types of infections that can cause similar symptoms. So we could have the Lyme, we could have Babesia, malaria, we could have these worms. There are definitely, but it's not like an infinite number of different types of parasites that could make us sick. It's like 4 categories: worms, protozoa, bacteria, and fungi. 4 categories. It's not that hard. And then 2, it's not like the researchers today have to start from scratch and they have to go digging. We have such more advanced technology today than we did in the late 1800s. So we have better technology. We have all of this research at our fingertips. You don't have to go to a university. Like when I started my science degree, you'd have to go to a university library. You'd have to go digging through books and trying to find things and taking books out or photocopying things. You can find studies just at your fingertips. All the research I do is available to any practitioner, any researcher. So they have all of the historical data and studies. They have these incredible, incredible insights from these amazing researchers and doctors in the past. We are now recognizing in the 2024 McDonald criteria that MS, that this whole central vein sign, where the lesions are always centered around a vein and there's this iron deposit, and yet nothing is changing yet. And I wonder why. I don't like to accuse, but is it that there's no money in this research? There's no money in treating a protozoal infection? Is there no money in treating parasites at all? We're not talking about cures anymore. Now we're just talking about trying to manage the disease, trying to manage our immune system better. It's really frustrating. And I see it on my end because we support people in the Live Disease-Free plan, helping them to recover from these diseases like MS, but other diseases also, helping them to treat these chronic, deep-rooted parasitic infections. They're suffering terribly, and it really bothers me a lot because, number one, it's by the grace of God we're doing this work. It's by the grace of God I found this information. yes, I've worked really hard to put it all together for you, but this has to change. We have to demand, like, it is really exciting. I have many students, young and old. One student in Europe, his mom and dad found me, and literally 2 months ago, like a 12-year-old, he was literally in a wheelchair, had a first attack, put him in the wheelchair, went in the hospital for a month. And today, 2 months later, he's training to play tennis again. His mom feels that he's basically 100% normal. He still has more work to do with treating the parasites, but this young boy who just turned 13, he is going to have the rest of his life as a full, active, full life. So it's shocking, especially with children, they can come back really quickly. All his doctors are just shocked at his recovery. But when you treat the root cause, then your body can just go back to running the way it should. You're very welcome. So, unfortunately, you have to make a decision. You have to decide, am I going to stick with this standard of care approach that we're using that is not looking for the cause? It is not going to cure what we're dealing with. We suffer, we miss out on years and years of our life, or do we take charge of our health? Pardon me. Or do we take charge of our health and get support, work with people that know how to treat these parasites, and get on with our life? And that's what the Wellness Champions do. I am going to go to your questions. I'm going to grab a little bit of water here. I think I've been talking too much today. All right. You're very welcome. Vortex Math. Yeah, it's been a lot of work, this research, but it blows me away. Again, I believe it's by the grace of God that we're doing this work. So I'm not sure why I'm feeling so hoarse right now, or why I'm so hoarse. Just one more drink of water. Yeah, please share this research with other people because it is so important. This is the only way things are going to change, is if you share this research, because otherwise it just gets buried. A little quick aside, for years I've been spending money on Facebook ads, and that's a way for people to find me, right? For Facebook to show our work to people all over the world. And when I started 10 years ago, they were very good at showing our work, but I really feel like I'm being shadow banned. I felt that just from the less and less people that are finding our work, but we actually stopped our ads, and our announcements went from maybe 500 to 1,000 people seeing it to 18,000, 30,000 people just in the last 3 weeks. So this information is being hidden. I cannot bring change myself. So I really encourage you to just share these videos, share the research, share the successes. We've got a lot of amazing successes on our website, livediseasefree.com. And it's really important to share because we are being blocked. There's an agenda to keep everything status quo. And unless we as the people, a grassroots effort, bring change, it isn't going to happen. So make sure to, again, type the word malaria if you'd like all the research links for that. Also, stay connected with us. Share this with different groups. Start talking. I know one lady I was talking to today, she was on a Telegram group, and she's like, she got her name from that MS group on Telegram, which is awesome. All right. Hi, Tyrone. Yes. Russell, have any studies been conducted with ivermectin and fenbendazole to destroy these parasites? So ivermectin and fenbendazole, they appear to be fairly helpful in treating cancers. And ivermectin could potentially be one of the treatments that we use in treating Could be one of the parasite drugs that we would use in treating MS and other diseases, but it's not, in our experience working with thousands of people all over the world, we're not seeing that it is helpful. So it's not life-changing. It can help, let's say, if in combinations with other parasite drugs, but people that have even, let's say, been energy tested and used ivermectin and fenbendazole, they switch to other ones. Fenbendazole is not a very like significantly helpful parasite drug, but for certain applications it is. If you're talking about cancer, then yes, certain cancers, Joe Tippins was somebody who had terminal cancer, and he used fenbendazole, and he, as far as I know, he's still alive today. But the ivermectin, fenbendazole, in our experience, if it was that helpful, I would tell you, and it's not. It would be, so like, you have to use parasite drugs that will treat the types of infections that you have, all right? Ivermectin will only treat specific types of parasites. Same thing with fenbendazole. They will not treat malaria, babesia. So Yvonne, your doctor told you when reviewing your regular blood work that your red blood cells were irregularly shaped. You asked if cancer, he said no. So I'm not sure if you were diagnosed with MS or not, but that is something to look at. And it's not to say that if your red blood cells look normal, so the MCV, the MCHC, the red blood cell width, the number of red blood cells, if they all look normal, that doesn't necessarily mean you don't have this parasite. But if they look abnormal, then it's another huge clue that you could have this parasite. Because a lot of times they become very chronic and end up in the central nervous system more so. So Nicole, are they still researching this? No, the University of Calgary, I think it was 2017 I shared with you, they did a study where they gave MS patients. So I don't understand this, like, why are there not a bunch of, it's all money, right? Why are there not a lot of research places like looking at the University of Calgary's work and going, oh, I wonder if we can repeat this, right? Because that would be a real simple thing. They could give MS, they may not give us the doses to cure, but what if it's more helpful than the MS disease-modifying drugs, even something like hydroxychloroquine? I don't know. I'm not saying you should try it, because you have to have your eyes checked regularly because it can impact your retina. So you definitely do not want to wreck your vision. But if it's used safely and properly, I think, because they're using that for sure in lupus and other inflammatory conditions, what if it helped, right? Because the disease-modifying drugs are not helpful. They're not. They're focused on targeting our immune cells, and our immune cells are not the problem. And if we target our immune cells, then we end up being weaker and more susceptible to other parasites that we're dealing with. So unfortunately, Nicole, they're not. Yes, so we don't know, Tyrone, if it is actually malaria, but it's a protozoa that infects red blood cells that responds to malaria medication. Okay, so we know Babesia responds to malaria medication. The Plasmodium protozoa that causes malaria responds to that same medication. There can be different cousins, just like Candida has at least 20 or more different species that are similar, that their cousins they're all Candida, so there can be other protozoa. I know that Dr. Fry, I believe, from Fry Labs, he actually found a protozoa in MS and he gave it a new name, and that's another little piece of research that I've talked about that has never gone anywhere. So unfortunately, they're not even looking in this direction. They don't even want to, which is sad. But a good thing is that with this new McDonald criteria, they have been forced to acknowledge that in the center of every lesion, there is a blood vessel. So that's the start of going away from this autoimmune theory. It's the start of going in the right direction. It's like, okay, the damage that's happening that we're seeing on the MRI, it started long before we're starting to see those lesions, and it's because of the compromised little blood vessels in the brain. not our immune system attacking itself. Or no, it's not our immune system attacking our tissue. Yeah, so what you'll find even more interesting is not just what I'm sharing today, Yvonne, but you'll find it really interesting when you actually look at all the studies. Again, I'll have all the studies just like little short paragraphs, like their key findings. Look at the dates. It's actually mind-blowing when you see all of this. You're very welcome. So Tiffany, you just had the medications energy tested. The practitioner said pretty heavy duty and hopes that your body can handle. So I think you are one of my students. So your practitioner, I don't know if I just can't remember. I know I have a Tiffany in my class right now that's really sick that just joined. It's interesting if you got energy tested that quickly, because maybe there are some practitioners that have all of these tests in their office, but number one, you have to be ready to treat. And in our program, the prep phase is really, really important. And so that's, getting the carbs down, making the parasites less active, making sure you're having daily bowel movements, making sure you're sleeping well at night. There's a checklist we go through, and we can start the oxidizing enemas. Oh, I wanted to share something really wild. So one of our students recovering from multiple sclerosis, his wife just has had a lot of like what she thought were hormonal symptoms really bad for years. And she was given like certain surgical treatments. She was given hormones. She was put through the ringer. Nothing really helped significantly. And then she just literally started to use this oxidizing agent that we use for enemas to kill parasites. She started to flush the vaginal tract with that. And all of her symptoms are gone. Like all these years of all this PMS hormonal symptoms, her cycle is completely normal. What a simple, I can't even say the name of it because I literally will have this video taken off. Like that's how censored this topic is. But it is like pennies, and it has completely gotten rid of all of her symptoms that she tried for so many years to get rid of. She has more work to do, I think. I think that she's got, parasites in her gut also. But such a simple thing can give people such relief. It's quite mind-blowing. And this is what I teach, and this is the information you'll have access to when you hang out with us. So how do you know you have parasites? Estella, you can just do a Google search of live disease-free and parasite symptoms, and you'll find my article I've written on it. Very specific symptoms it's like a lot of times it starts with the gut. It could be a gut bloating, constipation, diarrhea, alternating. It could be brain fog, sleep disruption, mood changes, PMS symptoms. So a lot of times we think it's hormonal, but it's actually parasites. So all of these are early warning signs, and then allergies. And then, of course, we can get into some neurological symptoms. All of those are parasites too. So a parasite is any microbe that lives in your body and causes you harm. It could be bacteria, fungi, protozoa, or worms. Tyrone, thank you so much. You'd like to help me gather and organize the research that I'm doing. Yes, I really want so I'm creating this AI tool that is only trained on the live disease-free approach and all this research, which is going to be available very soon for the general population. And then the next step is I'd like to create a database. We've got thousands of pictures of worms, and just to create a database for practitioners so that they can have a way to really identify what their patients are going through, because they don't have good tests, they don't have experience, they're not trained on parasites. So it's hard for them because this is a whole new world, and it's so common sense. It's a lost skill that decades ago our practitioners knew about. Yes. Yeah, fenbendazole, it is like very few of our students use it. Out of like hundreds, I'd say maybe 2 people have used. I'm not saying that there's never an application for it, but even the doctors that I study under, they do not find that it is very helpful for the types of parasites that we're dealing with. Amanda, is boron something that you recommend? It's not going to treat you're not going to recover from it. It is a very important element that we should have in our diet. We can supplement with it, but it's not going to kill really large worms. It's not going to treat things in the central nervous system. And so this is what we always look at, is like, what's the benefit? Like, is it really going to do what it needs to do? You have to use the appropriate treatments for what you're dealing with. That is the key. So it has to be the appropriate, whether it's herbs, parasite drugs. Oxygen will kill any like bad parasite, big or small. But as far as the herbs and the parasite drugs and even other supplements, it really is like, what are you dealing with? That determines, Amanda, if it'll be helpful for you or not. So quinine, yes, those were the old studies. Praziquantel might kill it. No, I don't believe praziquantel. That's more of a flatworm medication. You're very welcome. Okay, I'll just do one or two more here. Texan, goatbush. So the herbs for Plasmodium and amoeba. So there are herbs, and we really do like herbs. They will, you just have to make sure that you're, number one, using the right herbs for what you're dealing with, because remember, it's not just this malaria type protozoa. We could be dealing with, let's say, Babesia with Borrelia. Some of us might have other Lyme infections that go along with this. Also, liposomal is important, so making sure that it is emulsified in a fatty substance, so it's going to go deeper into your tissues. We also use that in conjunction with oxygen therapies, because all of the herbs on their own, they're just not enough. And if you don't treat the larger worms, very often they are infecting us with these smaller microbes. So it's very important we treat big to small with each treatment cycle, like the bigger worms, protozoa, fungi, bacteria, and then go through it again and go through it again, building back the good microbes, building a healthy lifestyle. Those are all things that we do in the Live Disease-Free plan. So if you are new to all of this, make sure to check out our website, livediseasefree.com. You can go on the blog post, you can see articles. Just look at the titles. You'll be blown away. You can scan my notes. You can listen to videos when you're cooking or going for a walk or whatever. And then if you are at the place where you're like, okay, Pam, I've been following you. I believe I have parasites. I know that's what's making me sick. I need support. I don't have a practitioner right now that can help me. I need a plan and support. Make sure to watch my masterclass training, and then you can fill out a form and book a time to chat with me to make sure it's a good fit for you. You're more than welcome to join the wellness champions right now that are on their journey, and we have mind-blowing successes every week. It's pretty inspirational. So Robert, you pushed your way into a study and you found that you had CCSVI. So that, again, is part of this vascular disorder. So that's the narrowing of the veins, right? Inflammation in the veins. And the problem is that you were treated for blockage and you're 100%. Well, you're the first person that I've heard that's worked for. I'm really happy to hear that. I have spoken to thousands of people. Every person that I've talked to that had CCSVI, they had the treatment done. Some of them may have had slight improvements or none at all, but it didn't last. So I'm really happy. But please keep in mind that if symptoms start to come back again, you never treated the cause. You opened up the problem, that one vein that was narrowed, but what caused that vein to become narrowed is the bigger question. And so treating the root cause is really what is going to help you to make sure that you don't have any issues with that in the future. So Tiffany, when doing oxygen therapies orally, how much does a person take out throughout the day? So if you are my student, then you go onto the resource page for the oxygen therapy and you will see there, you have to start really low and slow. It's usually like one activated drop in a large bottle of water, and you're increasing it slowly as tolerated. But you do that when you are ready to start treating. Thank you, Robert. Really appreciate your kind words. All right, I'm going to let you guys go. So if you appreciate the work that I'm doing, the research I'm sharing, number one, if you want the research, make sure to type the word malaria in the comments or direct message, live disease-free, and we'll send that over to you. And if you want us to help spread the word, then make sure to share this video far and wide. Start talking about it. Start sharing the research. Start sharing the studies and say, hey, have you seen this? Because that is the only way things are going to change. That's my goal, is before I'm too old to keep doing this work, I want this to be in the hands of our practitioners. That's where it needs to go. So help us spread the word. With that, I'm going to let you guys go, and I will see you next week. Take care and bye-bye for now.